America, land of the free, land of the money, and mainly land of the opportunity. The United States gives millions of America the opportunity to get screwed.
I am a third-generation farmer. My family farmed soybean and cotton. They ain't got to live tough, and so I had to get a second job.
I have a 1-year-old son. I'm a single mom. I make $7.50 an hour at McDonald's. Say hi.
They have no home of their own. And every morning they come to the Manor House charity, where the poor of Baltimore meet for a little food, warmth, and compassion.
They get screwed by this one thing called violence.
New video shows the moment a suspect reportedly opens fire on Chicago police officers responding to a call in Little Village.
Video just released by Chicago police show a deadly shooting in Auburn Gresham as they try to find the gunman.
Released new surveillance video of the suspect as he opened fire on Saratoga Avenue and Prospect Place. This happened in Brownsville yesterday.
Police say someone opened fire from a moving vehicle and took off.
And I'm not going to be talking about the gun violence that occurs in the U.S. constantly, that affects thousands, if not millions of people yearly. But today's subject is closely correlated to gun violence. And I would honestly say it goes hand in hand, but it's a little bit more softer. And today's subject has been so much of an issue that a CEO of a healthcare company was shot dead. Aw, so sad. It's almost as if he was a good person. Oh, never mind. Well, ladies and gentlemen, if you guys don't know, today we're going to be talking about the healthcare system in the US. It is common knowledge that the United States healthcare system is completely garbage.
I got a $14,000 ER bill for just being there for 3 hours. $14,000.
Guess how much we pay for health insurance in California as a family of 4. We pay $787 for an adult, $520 for a baby, so in total for a family of 4, we pay $2,614 a month.
In my mind, insert cash or select payment type.
There has been many videos made on that subject, and I'm not really gonna regurgitate each and every point that those YouTubers made, and I'm mainly gonna be talking about
Medicare for all.
We will have Medicare for all.
We have a chance for Medicare for all.
Medicare for all?
Medicare for all.
Now there's a lot of talk about Medicare for all.
Now, since the United States does not have universal health care, they have what we call a multi-payer system. Private insurance for employers or people that want to do individual purchases, government programs, and if you're part of the 27 million Americans, well, like John Oliver likes to say it,
you're fucked.
And all of that is going to be replaced with something called Medicare for All, pushed by Bernie Sanders and Elizabeth Warren. Many Democrats have been worried about it, and conservatives hate it.
We cannot afford Medicare for all. This is the end of America as we know it economically.
I think literally 90% of hospitals would go under tomorrow.
Right. So Medicare for all. I lived in England, Sean. Nationalized healthcare is a disaster. When rich, famous people get sick, they don't fly to Canada, they don't fly to Cuba, they come here because we have the best medicine in the world.
Look, I get it. America is a really good place to get your healthcare if you're rich and famous. But unfortunately, a lot of Americans are born with this one condition of not being Beyonce. In fact, many of us suck at that skill of singing. Now, despite millions of people having insurance, there's an additional 45 million people that are underinsured, meaning that if there's one emergency, they're bankrupt, they're screwed, they're under the water. That leads to millions of people going on GoFundMe and doing some crowdfunding campaign to fund their medical bills. And for every heartwarming story that you would see on GoFundMe, approximately 90% of crowdfunding campaigns don't hit their initial target.
Sheila's fundraiser isn't going as well as they'd hoped. About a month in, it's only raised $610. Early morning on the day of Sheila's surgery, her parents are still trying to get the word out.
Okay, so we're gonna make her sign #Eyes for Sheila. Very good.
Now, Medicare for All comes with its fair share of criticism, mainly by people on the right. And there's 3 types of criticism that you will mainly hear from Republican people, starting off with the cost.
This sicko socialism would cost roughly $32.6 trillion over 10 years. Even if you doubled tax collections from individuals and corporations, yes, that means you'd be paying twice what you already do in taxes. That still doesn't cover the tab. My God, free healthcare is expensive.
$36.2 trillion. That is a lot of money. And if you actually do your calculation correctly, that winds up at around $3.6 trillion. Bear with me. That is a lot of money. But if you actually do the calculation correctly and then you actually look at the actual numbers, the United States spends about $4.5 trillion per year. Yet, they get worse outcomes compared to other countries like France, UK, Canada. That is insane. And if you actually look at the graphs, the biggest expense is mainly on administrative costs. And if you actually compare the actual percentages, it's actually lower. So my dear, Medicare for All will actually save a lot of money to the US. But let's say for the sake of argument that it actually increases the federal budget. I would honestly say that you would be getting a lot for your money because Medicare for All is actually more generous compared to other single payer healthcare systems around the world. It covers dental, vision, and many more. You would be getting more for your dollar, and actually it will reduce the healthcare spending that employers spend on it. Now, will it actually balance the budget? No one really knows because there's too many variables at play. First of all, you guys need to understand why is healthcare treatment very expensive compared to other developed nations. The first reason is because when you go for a treatment, you don't really have a price. You have it like a price range, price estimate. Well, if you go to Costco and you look at the chickens, it's gonna be like $10. God forbid, if you get to an accident and you go to the ER, you have no control over the price. The doctor is just gonna do the best of their ability to stabilize you, and then afterwards you're gonna receive a bill at the end. It's kind of like a cartel.
Really what it's fostering, which I think is more important, is a discussion on healthcare in general in America. It's not a free market system at all. What's wrong with American healthcare is that it's a fully operating drug cartel. You're completely blindfolded. You have no idea how much anything costs. The insurance companies are making deals. You've got like the government involved. I say it's always the exact aims of the Mexican cartels were actually accomplished in America. A partnership between the government, the insurance companies, and the pharmaceutical giants.
You have a right-wing person talking about the healthcare in the negative way. Now you have a problem. Mix in also government regulations and insurance companies trying to maximize shareholders' profits. And then you get this mess that we are in the United States. With Medicare for All, it will eliminate all of this issue. So the patients won't be at the mercy of the doctors or the insurance companies. The second major criticism that you will hear of people campaigning against Medicare for All is the wait times.
If you think it's fun to wait in line at DMV, you're going to love Bernie Sanders' wait times for Medicare for All.
It leads to the kind of care that people now have in England or Canada where you have to wait in line.
Just take a look at Canada or the UK. It means long waiting lines. It means people not getting the health treatments they need.
Now, I get it. I surely don't like waiting in time, and I assume that you don't. When you see that long line in Costco, you just want to pull the fire alarm and sneak your way past people. Not saying that I already have done it. I'm saying you just feel like doing so. The comparisons between wait time from one country to another is a bit misleading and a bit complex. When I mean bit complex, I mean like very complex. And the wait times that you mainly see of other countries around the world, such as Canada or UK, are mainly for non-emergency care. And it's not like Americans don't have to wait already. They're mainly forced to wait because of cost. Half of Americans have reported skipping going to the doctor or going to the hospital because of costs, and 1/8 of them have reported that their conditions got worse. And for the uninsured people, they often have to wait in line, like in Costco on a Saturday, to receive their care.
Having got their place in line, many camped out for the night. Before dawn, this was the moment they were waiting for.
Number 1, come on down. Number 2. Right here. Number 3.
One by one, patients are let in for their chance of a visit to a doctor, a dentist, and an optician.
Holy. Like, you would think that this is a third world country where you would see poor people waiting in line to receive treatment, but no.
This is America. Don't catch you slipping now.
The last major criticism that you would hear from people campaigning against Medicare for All is the lack of choice.
When I hear that health care is a right, what I hear is healthcare will no longer have choices.
Under Medicare for All, your choice of health coverage disappears.
Americans are still Americans. We're not socialists, we're not communists, we like choice. And we like to have choice in healthcare, especially.
I get it. Americans love choices. I do love choices myself. If I had the ability to choose between moccasins and Air Force Ones, I'm going Air Force Ones all day, every day, baby. But I will honestly say that the lack of choices should not be a major concern for American people. Because the way that the insurance system, the healthcare system in general is set up, I would honestly say that it actually limits the amount of choices that people can actually choose. Doctors and nurses are actually bound by whatever the insurance company says, and people are bound by whatever insurance policy that they have from their job. They get what they get and they don't get upset. And changing jobs can be really complicated for a lot of families. And even if you do everything the right way, you can still get screwed.
While campaigning in 2018, Democratic Congresswoman Katie Porter's appendix burst. Her first thought, how much would it cost?
I didn't call an ambulance because I knew it could cost a lot if you call an ambulance. And I had specifically had my manager drive me not to the closest hospital, but to the in-network hospital.
Even though the hospital was in her network, the surgeon who helped save Porter's life was not, and she got a bill for nearly $3,000.
With Medicare for All, it will eliminate all that issue. For example, if you look at the price of insulin, yes, insulin, the medication for diabetic people, it costs a whole lot of a ton compared to other countries. And it even led to people even rationing insulin, and it is very dangerous. There was even this one case where someone died because they got kicked out of their insurance at 26 and they could not afford insulin anymore.
Well, sometimes it's tough to figure out whether a post on social media is true. One that was shared millions of times claims a young man died because he couldn't afford insulin.
It claims 26-year-old Alex Smith there died because he couldn't afford insulin.
So honestly, I would argue that the current system, the way that it is set up, it gives you the choice to choose between your heart or your kidney. Whether you're a right winger or a left winger, the point still entails. Something needs to be done immediately to solve the issue regarding the healthcare. And the Medicare for All is one of the many possible solutions that is positively going to impact the lives of millions of Americans out there. It's not like in the past, nothing has been done to solve the issue of the healthcare. There has been Romney Care for residents in Massachusetts, the Affordable Care Act, also known as Obamacare, that helped millions of Americans that were too rich for Medicaid but too poor to afford individual insurance. And there's also been the bipartisan bill, No Surprise Act.
Now, new year means new laws, and there's one that will save you money and trouble if you or a loved one end up in the hospital. The No Surprises Act means surprise medical bills for thousands of dollars are hopefully a thing of the past. It's now illegal to get a bill from a doctor you did not choose and who did not accept your insurance.
But if you actually look at it, all those bills, although it has helped a lot of people, it's kind of like a band-aid on a gun wound. John Oliver best described it.
So that's kind of like being offered either a shit sandwich or a slightly smaller shit sandwich with guac. I mean, I guess I'll take the second one if you're asking, but honestly, the lack of guac wasn't really my main fucking concern there.
In conclusion, this has been part one of a two-parter series in which I talk about the current state of the healthcare system in America. Next video, I'm going to talk about what healthcare models can the US implement next and which one would be very beneficial for them. Thank you guys for watching. It has been a pleasure to make this video, and we will see you next video.